about the differentiation of loss of smell and taste with meridian palpation treatment. So after this morning, the first two lectures, I think everyone started to get some good taste about LACA's features. We have four very good lecturers. Well, we have five today. We only had four today here, but we have five key lecturers. We all have our speciality. We all have PhD degree obtained in Chinese University of TCM, and we are all having at least 20 years of clinical experience. So we are both highly experienced in teaching and highly experienced in clinic practice. So we have a lot to offer in the lectures. My specialty with the treatment is a combination of a fusion with a meridian, acupuncture, and herbal medicine. So, and also a fusion of the acupuncture theories along with the Liuzhong. So this morning's first Liuzhong talk by Dr. She is about the general information about Liuzhong and the association with the symptoms of COVID. And me, today's talk will be more into a in-depth reading or insight of those illnesses, and also give you some special tips about how to really put the theory into your practice. So this is how I do. Just to choose a comparatively easier and smaller topic to give within this 40 minutes of time of talk. So the summary of from the viewpoint of meridian palpation, the summary about the pathology of COVID-19 infections, related to those early stage of infection, as well as the long-term symptoms and sufferings of patients. How we look at this is just three layers, or we call three dimensions. The first layer, the first dimension of those pathology is about a young meridian. So we say the COVID-19 virus enters the body, then the susceptibility of different young meridians in different human body determines development and presentation of disease. Therefore, those Taiyang, Shaoyang, Yangming have their each individual features and nature of prognosis. So it means because the Taiyang, Shaoyang, Yangming, as you know about from the first lecture, you understand they have different natures of 5 elements, but also nature of different compositions of yin and yangs in their nature. Therefore, they have their own different features prone to specific different type of the illnesses, what they call external evils, so PDFs. So, for example, the Taiyang is very prone to cold, and Shaoyang prone to the wind, and Yangming prone to the dryness and heat. So that's why they shows up more pronouncedly in practice and in clinic, and their specific symptoms are associated with their different types. So this is the young meridian as the first layers, and the second one is the yin meridian quality. So yin meridian quality actually determines the constitution of each patient. So each individual determines their susceptibility to the virus and its direction of progress once in the body. So it means when the virus enters the body, because they have different preference toward different young meridians, and because the specific young meridian related to specific yin meridians, and that yin meridian determines the body's constitution. Therefore, the development of those virus nature can develop into different direction. For example, the same virus enter the body like COVID virus, they can get attacked to 5 members of the family, but each member may develop completely different symptoms. That's all down to their constitution as well as the preference and susceptibility of the yang meridians. That's what we're talking about. So therefore, a good recovery, or whether they can survive from the infections or recover quickly, it depends on the state of the yang meridian and the state of yin meridians. The third dimension is the pathological product due to the infection. So this the pathological product, that means from the first, the yang meridian and the yin meridian attack, and because of the constitution of the body, so they are able, the body, once they get this attack of virus, and those disturbances start to form, and then the result of the disturbance, all these disorders of the yin meridians and yang meridians, and associated with all the internal organs, we started to get, producing some pathological products. For example, like the phlegm and dampness, or even the blood stasis. Therefore, and all these, once this is kind of what we take this as a rubbish in a system. Once they start to pile up, and there will be the problems with the transport of good nutrition and good qi and blood and all the goodness coming towards the damaged area for a recovery and a repair. But because the road is blocked up by all these rubbishes, then therefore the repair and good recovery, the quality of those recovery is badly, greatly affected by these. So therefore the pathological product will decide the quality of those the fully recover from these infections. Therefore, we look at these three layers of problems, and that actually put into practice will be the checking of the meridians, and from specific meridian points and a diagnostic point, and via the meridian palpation method, then we can have a precise differentiation to help us to guide us through into a more efficient, quick response, and a complete, a good quality of recovery from the disease. So therefore, differentiation will focus on the three aspects: the yang meridians, so which is like we say, because we also believe yang meridian is the one that stays outside the external layers of the body, working as the immunity function, the defense systems. So they are the bladder meridian, gallbladder meridian, stomach, small intestine, large intestine, and Sanjiao meridian. And very much they are 5 element involvement. Obviously, the details about this involvement, details about how they interact with each other is not really not about today, just because of time limit. However, just give you the ideas. The yin meridians, they are more related to internal constitution. So we need to look into all the other, the 6 yin meridian, like spleen, the lung, the kidney, the heart, the liver, and pericardium. The secondary pathology, the most pronounced pathology products are what we call toxins. So they are the phlegm, the dampness, and the blood stasis, which relate to COVID infections. We're not able to really talk very details. However, I'll just give you some ideas now today. When we have a patient presenting a loss of smell, like the problem with the nose, what kind of meridians are involving with the yang meridian, yin meridian, and secondary pathology could be. Therefore, we are looking for the yang meridians. The idea of meridian palpation is very much related to meridian distribution. So if you are familiar with where the meridian comes to the body, the area, and then you are able to really straight away work out what meridian can be involved. For example, okay, Dr. Shi has already mentioned about in the Taiyang level, the illnesses. The first symptom is the nose, right? The first symptom is nose, but why, right? So here, actually, meridian palpation gives the answers, just because the yang meridian bladder goes to the root of nose, right? Starting from the Jingling, the bladder 1 is in the corner of the inner corner of eyes. It's very, very close to the root of nose. Therefore, the extension of the meridian, the bladder meridian, could affect the nose very badly. Okay, so closely, when you had a cold, The nature of the cold is contraction, and also nature of the cold can be a clear watery discharges. So from the suffering of a Taiyang bladder meridian, the early symptom will be the blocked nose, which means the contractions of nose close up, and also could be the running nose. It depends. If this is the Taiyang Shanghan, so we call 表实 excess external Taiyang, then there will be which in the Shanghan Lun or in the herbal remedy, there will be the symptoms for a formula called Ma Huang Tang, right? But if that is a clear running nose, is actually a good formula that work for that. The mild symptoms can be used can be treated by the Guizhi Tang, because Guizhi Tang for this clear discharges can be, and then the severe one can be more like Xiaoqinglong Tang, or later on even like Ma Huang Fuzi Xixing Tang. So that's the more further down to the road. That when you come to the Ma Huang Fuzi Xixing Tang, that's already Shaoyin yang deficient type of that formula. But however, if you understand Taiyang bladder goes to the root of the nose, that explains why they have blockages nose as the first symptom of the early symptoms of yang meridian. However, this is the early symptom. They can stay until the last minute of the illnesses. It means they can stay even several months, even years after illnesses. They can still remain. Another thing, not only the Taiyang, not only the bladder goes around the nose. If you remember, large intestine meridian ended into the both sides of the nose ring, right? And also stomach meridian go just next to the bladder meridian. So they also contribute to the nose problem and the sinus problems. Therefore, the yang meridian problems, you need to look into Taiyang bladder meridian, Yangming stomach and large intestine meridian. And that's the one that we need to look into when people have the loss of smell. Whether this is the early stage or the long COVID, you are still need to look into those yang meridian issues. Yang meridian issue is the one of the starting point. However, when the illnesses, especially when we talk about long COVID, there got to be something else that make this condition continuous all the way down the road and is still persevering. So therefore, yang meridian is also need to be looked into. As we understand, lung opens to nose. Lung is the one that need urgent looking. But also, bladder meridian paired with or coupled with kidneys. Kidney meridian need to be looked into too. And obviously, Yangming, the stomach meridian need, also coupled with spleen. So spleen meridian need to be treated too. But one more thing we need to, I read here. We also should be, if this yin meridian, these three key yin meridian is looked into, and there's no strong signs of involvement of this yin meridian, yang meridian, there is another meridian you need to look into, which is the heart meridian, and that's also linking to associated with the heart meridian contributions. We understand the heart, the jingbie, divergent channels of heart can also goes into the inner corner of the eyes and go next to the nose. So if there's a problem with the heart meridian, there can be also a nose. So that's the one, especially when all the ordinary yang meridian, yin meridian being looked into, there's no a major effect of treatment being showing up, then you need to look into the heart meridian. And so yin, yang, and yin, now the secondary pathology, the phlegm, the fluid, and dampness. So there could be also blood stasis. That all can be, should be looked into. And then all these phlegm and fluid and dampness and stasis, they all have their specific diagnostic point in meridian palpations. They are like stomach 40 for phlegm, and spleen 9 for fluid and dampness, and then stasis like spleen 10 for blood stasis. All these can be also used in diagnose palpations. Then if they show signs, then we can consider to use that to help to release the symptoms of that. Loss of taste. That's the second one we could look into. Those young meridians, we understand because the taste is related to the tongue. So we need to look into the tongue. What actually meridian goes into the tongue, goes into the mouth. The major one with the young stomach meridian. So especially the cold and damp can trap into the stomach meridian and then causing all this loss of taste. Yeah, but I think things need to be stressed here is some of the people say I can't taste anything. It's actually when they say I can't taste anything, you need to really give a more in-depth inquiry about this, because I have had patients say I can't taste anything, and it's actually they can taste this the taste of that, like salt, salty, sweet, and sour and spices, but they cannot taste the food. So it's not the loss of taste, it's the loss of smell. So that's the things you need to clarify when you really give a diagnosis, right? So, therefore, to check if they are actually having problems with their taste, the tongue function, or the smell, the nose functions, is to actually give a clear question to ask, right? So can you taste the sweet? Can you taste the sour? Okay, taste, or is that you just cannot taste the fruit, right? So I know this coffee, but I cannot taste coffee. So actually, this is actually the smell, right? So as I say, the young meridian directly related to tongue function is the stomach meridian. However, a lot of yin meridian also linked to those tongue functions. We need to look into this. Is all to do with the connections of those the meridians into those tongues. You understand, heart opens to the tongue, right? However, spleen connect to the root of tongue, and kidney linked to the root of the tongue, and liver, it will say networked into the tongue roots. So that's all having some connections with all these four yin meridians. And secondary pathology, phlegm, fluid dampness, and stasis, the same thing you need to really look into, because as I say, all those secondary pathology products, the toxins accumulated by the process of the illnesses, the progress of the illnesses, in the end, will affect the recovery. So if people have a very severe accumulation of dampness in the body, there gonna be some problems with the mucus of accumulating the systems, and therefore the taste will be, because all those tongue coating get very thick, so they will start to affect the taste. But also, don't forget, they could be developed into the nervous system. Although Chinese medicine doesn't have a very strong the insight into the nervous system, we can still nowadays we can use our understanding more looking into the nervous system. It's not only just the nervous system itself. We're thinking about the function of the transmission of these nerve signals and the communication between the peripheral nervous system and central nervous systems. They're all down to a good qi movement of energies. Therefore, if there is phlegm, there is a body fluid or dampness or blocking in the way of the qi's transmission, there going to be some troubles with this. So even though we understand there could be some nerve damages with these smell center or taste center in the brain, and there could be still many ways that TCM can do to help to rebuild the connection. The first thing is to clear the way, to clear the traffic way, right? So to get rid of the dampness and phlegm, and also speed up the recovery by promoting the qi and blood circulation. That's the general idea. But the specific definition of this is to look for which pathways is exactly being blocked, what organs are exactly in trouble. And this is what the meridian palpation can help to provide, and can help to promote the quality and efficiency of the treatment. Just to give you some ideas by giving you the photos of the pathways, meridians, so that you understand what we're actually talking about. You can see This is the primary meridian pathways of the bladder meridian. However, when we also be looking into the tendinous muscular regions of the Taiyang bladder meridian, it goes to all the way up to the top of the head, and also the root of the nose. You can see some of them even go to the sideway, so it's directly linking to the nose problems. So when people talk about the loss of smell or blocked nose, you're not only just looking into the large intestine 25, Yingxiang point, or Shang Yingxiang, Bitong, and those points are good, but they are not, if they are not directly linking to the large intestine pathology, they are not as effective as the bladder point. So I quite often use the points like bladder 60 or bladder 62, which is very sensitive point when you check the patient who's got the pathology of a meridian, bladder meridians. The nose can be opened up straight away after even like 30 seconds of pressing on those points, or do massage on the points, 30 circles. Straight away it will be improved. These are the large intestine meridian. You can see also large intestine meridian. It goes all the way up by the root of the nose, and also side of the face and the temple, and across, and it up down to the other side of the face. So this large intestine. And stomach meridian, it goes from the toe all the way up to the trunk, and all the neck, up the neck, and also going into the area of they also go around the lips and mouth into the tongue, and also they have by the side of the nose as well. Spleen meridian, that goes from the toe all the way up the tongue, and also into by the throat up into the root of the tongue. So, and then go into the mouth. Heart meridian, they go from the lung and all the way down to the hand. However, the lung internally, it has connections with the throat and with the nose by the divergent regions. And kidney, it goes from the bottom of the foot, the sole of the foot, all the way up chest and going through the throat and into the root of the tongue. But also, as Professor Wang mentioned, it has branches going into the spine all the way up into the head, and then go along the dual channels feeding into the brain. Heart meridian, you can see it has the heart going into the little fingers, but it also has its divergent channels going all the way up throat into the tongue, and also divergent into the side next to the nose, and going into the inner corner of the eyes. Liver meridian, you can see it goes from the toe all the way up, and then by throat, by the neck, and up into the corner of the eyes. And also they have liver meridian, also the branches are in this area, the side of the head, also around the lips, inside the mouth, and also the roots. You have the lower connecting, and all the roots coming to networking into the roots of the tongue. These are the points I'm using for diagnosis of like spleen 9, stomach 40, spleen 10. Here we go. We're going to talk about a case study. As I said, this is a very quick seminar, just give you some ideas to explore the possibility of pathology of loss of smell and taste. Then the case study will give you more details about how I do with all these cases. Right now, I'll give 2 cases here. I raise. Case study 1, loss of taste and smell. And this is a lady who is a GP, and she doesn't live in the city where I'm practicing. I am practicing in Norwich, east of England, and about 1.5 hours east on the train to Cambridge, and about 2 hours train journey to London. And this lady is actually lives in Surrey, down in the London way. However, her mother is one of my regular clients, and because they have like Western medicine background training, they never believe in herbal medicine, neither with acupuncture. However, this lady, during the first lockdown time, because her husband is a hospital A&E doctor, obviously he brought in the COVID infections. He was the first one hit, and then he passed around in the family. So her, the lady, and her 2 young children all get hit badly. However, the two boys recover very quickly because they're very young. One is 8, one is about 11. So they recover very quickly, but they're left with 2 tiring, exhausted parents. So the husband and her spend months in bed, very, very tired, struggle to work, and brain fog, everything. So when she contacted me, I think it's about beginning of this year, they've already had a very long time suffering. So like about 6 months, more than 6 months of that loss of taste and smell, even after they're gradually coming out of those exhausting times. They've spent in bed, virtually in bed for many months for that, body aches and cough and fatigues and everything. And so when she contacted me, she said, she sounds a bit, positive because, oh, my energy is better, but you can see she's still having a lot of trouble. So the main symptom will be she had difficulty taste and smell. So eating food is like chewing paper. She doesn't really taste the food. She cannot smell and taste any food and drink apart from an odd smell constantly hanging around. She always say that is something strange smell or strange taste in the mouth. That's still blocked nose, worse in the morning. So you could see still something going on, particularly with the young Meridian. Why? Because the morning time. So you understand, between 5 and 7 o'clock is large intestine. Between 7 and 9 a.m. is stomach Meridian time. So therefore, in the morning, blocked nose quite often is a strong indicator of certain level of yang ming sufferings. That's the clue we're going to check into. But she doesn't have running nose anymore, but she always feel very dry in mouth and nose. And she doesn't have very good appetite, and she sometimes have noisy. She still experiences headaches sometimes on the right top of the head, with preference of pressure that may help give some relief for a short period of time. This is a very strong indicators, also a very helpful clue for diagnosis. When you say preference for pressure, it normally is a sign of deficiency, right? And also dry nose and dry mouth more or less also could indicate a certain level of yin deficiency. Energy was low, but slightly getting better. She was kind of, sounding positive, but actually is boosting by coffee. So it's not actually really good, but that's what she says. Bowel movement is softer and looser than usual and not as regular. So those looser and softer bowel movement stools can be an indicator of qi deficiency, but also an indicator of dampness. So we need to really clarify whether it is a dampness or qi deficiency. She still struggled to fall asleep, but no night heat or night sweat so far. So doesn't sound like she had a very strong qi yin deficiency. But the struggle to fall asleep could be issues with heart, could be issue with the liver, or could be issue with the yang meridian like Shaoyang, right? Next slide will be a page of her tongue. So we can have a look at this, right? When we look at this tongue, right? So tongue reading with meridian palpation also have a specific process on different slightly different from the conventional ones. However, this will be taught by the LACA course. We have a CPD course, 1-day course, or in weaved into those the basic Chinese series the teachings as well in those foundation teachings. We can also teach in that. Let's look at these ones. This lady's tongue is long and slim. However, the color of tongue looks quite purple. In a way, this purple color quite often is an indicator of Shaoyang suffering, as well as some Jieying issues, right? And also the tip, you can see a little small tilt up, also kind of split in the tip. That quite often indicate some deficiency of the heart itself. And then the front part of the tongue looks very dippy. And that part is the lung. So that indicates there is a certain level of those dip normally indicates the qi deficiency. That indicates some lung qi deficiency. However, the tongue texture looks a bit kind of yin and blood deficiency type. So that could be an indicator of heart yin, lung yin deficiency, and qi deficiency. From the middle, you can see quite a long dip and all the way down to the root, right? So this actually spleen deficiency as well. And with those greasy, whitish, with a hint of yellow, it could be a indicator of dampness turning to the heat in the body. So this is from the tongue itself. And so we put it here, the readings. Thin and slim, but long, light red, but purple and dark. Side rolling up, split on tip, and dip tip in the front of tongue. This is all what I explained to you. Medium dip in middle and root, coating thick and light yellow greasy. So damp heat. We can see a certain level of externally, there could be still some external issues from the tongue itself. Very difficult to tell the young meridian issues. The tongue reading normally can give more details about the yin meridian because they can tell us the constitutions and can tell us the secondary pathologies, dampness and phlegms and all that, but has difficulty to tell us exactly whether this is a Taiyang, Yangming, or Shaoyang. So, but the Shaoyang itself can be reflected by the purple color. So this tongue indicate a certain level of Shaoyang issues. However, whether there is a Yangming, that's a Taiyang, we don't know. So I did ask the lady, a very busy mother, to report back on her ratings of the meridians, which is a major process of my diagnosis and treatment. However, she was too busy. She cannot, even I waited about 3 days, she cannot give any time for herself to get the rating reported back. In the end, I have to, in order to give her a good remedy, because her mother, urged me to say, okay, please send herbs. I just want to see her to feel better. So I did not get any report from her, but only just based on what we get together here. From the symptoms, we think that is Yangming issues. From the tongue and from all the other symptoms, we believe there's a qi and yin deficiency. There's some damp issues in her body. Therefore, we work out a formula in here. Just give you some review back our kind of all over the tongue readings in here. These will be taught by the meridian palpation. Oh, by the way, we have already finished one of the CPD course, which is about 2 separate 2-hourly sessions of those about the COVID, post-COVID, and COVID of associated symptoms, and meridian palpation, specific meridian palpation diagnosis and treatment lectures. So if you are interested, you're welcome to inquire with us. I'll look for this information on the LACA's website. And this part of that tongue readings and all been we have all been recorded in the lecture videos, and that's available for students who register for that course. You can look into that later. So this is what we say. As you say, tongue coating, tongue body, sublingual, they all have good reading meanings, and that's all here for you to explore later in the future. So If it's a standard treatment process, there will be recording of those symptoms, main symptoms, and possible signs. So my analysis is here, like the nose, change of smell, blocked nose, worse in the morning. I normally will go large intestine, stomach, but also we need to look into the lung, the bladder, the kidney, and spleen. Right. The tongue, change of taste, appetite, so her dry tongue and a change of taste and appetite, dry mouth, stomach, spleen, and dampness can be the one that we need to look into. So checking on the meridians. The headache, top of the head, there could be bladder, gallbladder. Digestion, softer and loose stools, nausea, could be spleen, could be large intestine, gallbladder, sanjiao. Right, so it's because gallbladder sanjiao can have troubles with the stools, can have the troubles with sickness, nausea. Right, struggling to fall asleep, and the tongue. So normally we could do, there could be the heart and also shaoyang, sanjiao, and the gallbladder. They're all in associated. So these actually were the meridians I asked her to check. So I don't really ask the patient to, give the names of the point to ask her to check. I will give the photos of where the points are marked as a crosses on a real body picture and ask them to do that. So for people who has no background of meridians whatsoever, they can still able to follow the picture, to palpate, press, and give a rating of the sensitivity. This is how we work out those rating reports. In the end, without the report, I can still manage to get a certain formula, just because more or less the idea is there. So we understand there could be the problems of stomach, large intestine, and bladder, and yin meridian could be spleen, lung, yeah, and then there could be also heart, qi, and yin deficiency from the tongue itself. Secondary pathology, there could be dampness, could be the phlegm turning into heat. Therefore, I gave the formula here. So as I say, I went to the University of Chinese Medicine, Traditional Chinese Medicine in Beijing University with the internal medicine. So I came from the herbal background. However, when I started my practice as a TCM practitioner, mainly as acupuncturist from 2003, I worked majorly with acupuncture for many years. And I'm teaching in London, some of the colleges and across Europe, and also mainly acupuncture based. However, herbal medicine is still one of my strong using it in my practice. So I will be teaching several lectures with the herbal course too, yeah, and as well as the acupuncture in the future. So you can see here, I was using the Gui Pi Tang to promote the spleen because the taste, but also Huo Xiang Zheng Qi side in here. So we're using Dang Shen, Fu Ling, Cangzhu, Chen Pi, Fa Ban Xia, Mu Xiang, Sha Ren, Hao Bo, Huo Xiang, Zhi Ke, Pei Lan, Bai Zhu. So the first part is very much like the Gui Pi, and then also then we go to Huo Xiang Zheng Qi, and then we have Zi Su Ye, Cang Er Zi, Sha Ren, Sha Shen. That's to do with the yin deficiency, like Lang Yin, Bai He, Lang Yin. And then we're using Ma Huang, Xing Ren, and this is actually the coming to do with the bladder meridian and stomach and large intestine meridian, working on the external yang meridians. And then Digupi, and Digupi is to look after the kidney or the other yin deficiency. And Jiagen have a lifting effect to help with those opening up of the orifices. So it's about 10 days dose of concentration powder. The result, and this lady, very interesting, and she never really talked to me anymore. However, her mother managed to get all the feedbacks, and after taking the powder for 2 days, she reported back that all the smell and taste in the mouth went completely. And 1 week later, the smell and taste recovered by 70%. From this, the summary from this first class, the first case study, and I've learned several things. So I'll just put out here. The young meridian disorders can still be a dominant factor even after so many months of illness. Like this lady, 6 months, she's still having troubles, and we still need to work out the young meridian issues. Without proper treatment to release the relevant meridians, successful treatment cannot be achieved. So it means, even though you see this is a lung issue, that's spleen issues and kidney and blah, 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 all these internal yin organs, but don't forget, there can be still some young meridian issues. We need to work on that, and that can give you a much more quicker effect, bring out. Second, yin meridian imbalance is usually the key factor to determine the progress of the illness. Precision differentiation is necessary to help support the successful treatment. However, careful balance between tonification and detox, eliminating the young meridian pathology is very important. So it means, from that, for her case, you can see a clear some qi and yin deficiency, but there's a lot of dampness. There's still some young meridian issues of those blockages. You need to work out a good balance. And secondary pathology plays a big role in the recovery quality. Damp and phlegm usually is the key factor to slow down the progress. It is common to see in practice that a mix of heat and cold, yin deficient and damp, external cold and internal yin deficient heat can coexist. Experience on dealing with the complication with careful selection of herbal ingredients of different nature is highly in need. So that means, when you see so many, such a complexity of different natures of pathology, how to work out a good combination of these and a compound of yin tonic and damp, or qi cooling and warming, dispelling the wind cold, and that needs an experience. But with a good understanding and also good practice of meridian palpation, you are able really to work up properly. Just because once you use, like for example, for this case, we use the ma huang. We can use the ma huang in this case because we understand that still some cold issues into the external, and we work on that, and it doesn't really affect too much of the yin deficient heat internally. Once you know the weighing of these issues and carefully using it, you are fine. And then that is not that easily to be achieved if you only coming from a internal medicine like herbal training background, because that's need many years of experience to work out a certain way. But with your meridian palpation training background, you are able to do it more bravely, and you do it more efficiently with that. Second case, case study 2, loss of taste and smell, is one of the students. So one of my students in Poland, I've shared with this case in many of my teaching group social medias, and as a kind of a quite interesting and good surprising results from this case, right? So this lady contact me via WhatsApp after we had the CPD, COVID-19 associated conditions and meridian palpations, and she actually had about a week before she contacted me, she had those COVID infections. Initially, she had running nose and back pain and developed loss of taste and smell. And her husband had the same thing, but they both had treatments like acupuncture and some of the herbal treatment, which helped them to recover quickly with those early symptoms. She doesn't really have much of symptoms apart from those loss of smell and taste. So at the moment, no major other symptoms. She only had quite nearly 100% loss of taste and smell. She had some herbal preventative formula of Huoxiang, Cangzhu, Lianqiao, Fangfeng, and Peilan, all this for a long time, and no effect. Tang, see next page, post not available because it's distant. But however, this is the initial text she sent to me and for help. She said, "Hello, Professor. I would like to share with you that I and my husband had COVID. Last week, I had a runny nose and a slight 2-day weakness with back pain. Then I lost my sense of smell and taste. Besides, we feel good. I'm glad that this is all. Because of my asthma, my husband had a wavy fever, but the herbs, needles, and essential oils worked very quickly, and nothing else is wrong with him. We have been drinking the recipe for a long time from Professor Sun Peiling, Boxiang, and all this. Do you recommend anything for the lack of smell and taste? Regard and all the best for you and your family. What I did with this case, because she studied acupuncture with me, and she also attended one of my workshops of meridian palpation. So she knows the meridian palpation, the whole process and everything. So I sent photos of this meridian she needed to check and ask her to report back the points ratings, and also give her the point that shows after she report back the result. I give her the point that shows comparatively higher sensitivities, and then she can do her self-treatment. This is what my plan was. And this is the tongue. You can see the tongue. She had a slim but purple tongue and red, right? And you can see yellow greasy coating. So that's quite a bit of phlegm and dampness in her body. Some certain level of qi deficiency, because also see, and also yin deficiency, because the tongue looks smaller, and but also dampness and qi deficiency. You can see also the tooth marks on the edges. So that's quite a complication. However, she reported back to me that weren't much of those highly sensitive point that we call positive, that gave me a very strong impression that we need to work on that, and that can help. The interesting only to see stomach 44, left equals to right 7 out of 10, and also goblet 41 6 to 7 out of 10. That's the only one that shows a certain level of the sensitivity. What we know in meridian palpation diagnosis, what we are looking for is the sensitivity point that is rated 7 above, 7 plus. The other one we call positive. That means the point that's related to the meridian has the closest pathology to the chief symptoms. That's the idea. So that looks like only stomach 44, the one that can be related to those loss of smell and taste. However, this doesn't really explain much of that. And all the other yin meridian, they are not high enough. So that gave me the problem to give her a good plan, a combination of point selection, because I think stomach 44 might not work on itself, right? Because I believe she's already done those points massaging or acupuncture, and it didn't seem to be working. So we need to look more into details. Therefore, what we did is have a WhatsApp live consultation. So I spent about 1 hour or so of time with her, going through all the meridian, to see if the meridian can have some effect. This is what we call test the treatment process. So we do, different directions on massage on the point, and then ask her if that has an effect immediately after massage on the point. And then the point that has some immediate effect usually is the point that need to be treated and used for future treatment. So this is what we did on one of the Sunday afternoon. Here is the meridian palpation results. Okay. Right. So what we did, through all this process, we found out actually there are very mild symptoms that improve through stomach and liver, and large intestine that was about a little bit up and down effect. So this is the only one that shows some potential, which is not very ideal to me. You see, it doesn't really have an immediate effect. However, based on that, I believe this is we believe the conclusion of diagnosis work coming down here is wind cold turning heat on Yangming and Shaoyang, spin qi deficiency and lung yin deficiency from the tongue, and liver qi stagnation heat and heart cut. And it's often those mild ratings of the report will give some extended thinking. Therefore, I gave the treatment plan for her is Dao Qi. So this is the learning from Professor Wang. We'll do the Dao Qi technique on the point, yin tang, and also the head and the nose and tongue zone on the scalp acupuncture. And we'll do enforcing on large intestine 11, stomach 44, spleen 3, and then also reducing on gallbladder 41. And then, do the massage point or acupuncture for that. And 3 days later, she report back to me, Professor, immediately after treatment, my sense of smell, taste do not improve. But every morning when I start my day, I can feel the difference. And now after 3 treatments, the level of my smell is about 7 and the taste 5, but it gets better every day. So even though that wasn't a successful immediate test treatment, we still managed to get a follow-up treatment going and bring her back onto the right track. So summary, when symptoms are prominent, but major of the meridian shows low sensitivity, this is a strong sign of yin qi deficiency. Even within the yang meridian, strengthen spleen qi. Sometimes necessary lung and kidney too. Even during the very early stage of illness, the deficiency of yin meridian, yang meridian may happen and act as the key factors with complicated and stubborn cases like hers. Work on a meridian that shows even very mild effect, then adding in yin qi tonic should help. That's what we did with spleen 3. Perseverance. Perseverance on the point is very important. 3 to 5 days persistent treatment should help to achieve positive effect. So that's all about today's talk. So it's a bit extended time. Thank you very much. I hope to see you soon in our future courses.
Okay, thank you, Dr. Ye. Thank you for your great presentation and the case studies. But due to the time, sorry, we can't hear more detail. Hopefully in the soon future, I think next month, your CPT courses, you can explain more detail. Okay, let's welcome our last speaker, Professor Dr. Tiejun Tang, for his presentation.